My name is Tembi Aris. I am a medical intuitive. I use alternative techniques to diagnose and treat illnesses. I've done this for over the years, and I've successfully diagnosed and treated people with the most complicated of illnesses, which have baffled even the best of some of the medical specialists. People call me Dr. Alternative out of endearment. The health industry, or health, has got two dimensions: the alternative dimension and the medical dimension. But unfortunately, these two dimensions don't talk and they don't collaborate, to the detriment of the recipients, that is the patients out there. I am the epitome of these two dimensions.
Join us on their journey to better health and renewed hope. This is Dr. Alternative.
Welcome to Dr. Alternative Show. Today we have a slight change, which is to your advantage actually, and might be even more interesting, in that we've got a guest, a mother that has got an autistic child, even though he's not officially diagnosed as such, but the symptoms and everything apparently confirm that this is, or given some kind of indication that this is what we'll be dealing with. Lupolo is going to be talking to her, interviewing her, and enjoying the interview.
Welcome to another lovely episode of Dr. Alternative. I go by the name of Ulukolo Nondwana, and we will touch base yet again because it is Autism Awareness Month. So I'm joined by the lovely lady who will introduce herself.
Nomthandazo.
So you have a child that has autism.
Yes.
Right? Yes. Now just tell us, how are you related to the child? Are you the mother or the grandmother?
Yes, I'm a mother.
You're the mother?
Yes.
It must be difficult.
No, it's very difficult. He still is in nappies, he still wears nappy, number one. Number two, he can't go by himself to the shop or to be outside the gate. He doesn't understand that there's a car and it's going to hit. He doesn't understand that. Just go. You have to always lock the gate. Always check every 5 minutes, check it, where is he, what is he doing. But he likes to climb. It likes when come up, isn't in the floor.
In the floor, yeah.
It likes man too.
How old is the child?
The child is 10 years. This year is 10 years.
And when did you realize at first that he's
autism?
He's autism, yeah, he's autistic.
When he was 4 years, because I didn't take him to clinic for his immunization. Okay, everything that goes, how he weight, doing everything. But at the end, the next month was asked me, how well is he now? Is he can sit, he can eat by himself, he can talk, and I thought that he can't talk. So what you got to, they say, man, it's like it's autism. It's autism.
And they were saying this while he was still 4 years old.
It's like autism, because he cannot talk 4 years.
What were the signs that you noticed at first before taking him to the clinic?
He likes
What made you take him to the clinic actually? What were the things that he was
He can't
doing
understand.
at first?
If you say to him, go to the toilet, he doesn't understand. Even if you take him to the toilet, he doesn't know he has to what is he must done. He's always in the net, because if you just leave him, okay, you can see other people, but okay, just now I have to pee now, okay, I have to use the toilet. But I didn't understand. He could just look at you, but what is happening?
So
he doesn't understand.
So what steps were you taking that time to make him understand, or at least try to make him understand?
Hey, make him, like, take other children to come and play with him so he can see other stuff, what other children do. But in an app I failed. I did take off the nappy, so she can know when. Let's go to the toilet, and then we took his nugget and put it in the toilet. Does it understand? No, I don't know what it.
You mentioned that he doesn't understand and he doesn't really communicate. So how do you communicate with him in terms of uyamdlalisa? Do you play with him, or what steps are you taking, like, to manage to communicate with him?
And there is something to understand. Masambe, he knows Masambe. Let's go.
He understands that.
Yes, yes. There's a shop there in the yard. Masambe Sotenga. Sotenga. He knows, but if you go to the shop, if you say Masambe, see even then we are going to buy something. He understand. Masambe understand. Sugar up. Don't touch that. He understand. It be back off.
And so when you bring other children, right?
Yes.
To play with him, does he play with him?
Yes, for a short time, but he plays. But most of the time he always take that. If he got the car, just like that, it's a scooter, always that scooter and go his way, and the others are saying go this way and leave the others there. But
so he doesn't really like being around with people.
Oh, but he can stay up here he understand us, so all of us in the house. He understand. But he can't play exactly. But okay, put it this side, and I'm going to be in that side. We are going to play. Doesn't understand. Okay, we can throw a ball. Okay, you can throw it back, but not straight to you. This play, it throws it in the air.
So what does he like doing?
Besides it, climbing.
He likes climbing.
Climbing. The gate, I always block the gate because he's climbing in the gate or in the fence, so he can grab that side, can jump that side. So
he started having this autism at 4, right?
At 4, but I noticed.
He's 10 years now.
He's 10 years now.
What more steps have you taken now since the time that you realized that he's autistic?
I didn't take much. I did there is a wellness clinic there at NU 12 or NU 29. There's a place called Place of Safety there in Motherwell. I did go there. There's a social worker there. They are working there, but it was up and down, and then I lost my phone. And the phone number was there, and I didn't bring him back there again, or in touch with that social.
Was that helpful?
At first, but as I said, I lost my phone. There was very tragic. I lost my mother within 2 weeks and my brother within 2 weeks. So I was very confused. So I lost my phone with the numbers. And after that, I didn't feel go there again.
Can you share now with the difficulties that you are facing and the frustrations that you have? Like, what are your frustrations to having your own child being autistic?
You have to know where is he, what is he doing
at all times.
At all the times, because he can take the pot and put it in the couch and take a spoon, eat, or he can. My TV is stay on the top. You see the wardrobe. He stay there. My TV stay there. You can't put in the place like this one, in the area. Yeah. No, he jumps. he wants to see these people, as I say like that, but he wants to see what is in the smaller age, maybe 4, 5. Like he want to see, he's going to see there's people in the TV. And it broke, that one. It broke. I have to buy another one. So it stays in the top. I always watch it like that, there in the top, because I can't, it's dangerous most now, and it is in the electricity. It's on. When he plays with it, it's not right. So I put it safe there and hide the wires around the wardrobe.
So you're the only one that can manage him?
Yes.
Right now?
I'm only staying, right now was a family of 4. Back then staying at my house. But I lose my mother and my brother. So I've got one brother now and me and Lucolo only. We only 2 people, 3 for Lucolo only.
What are the things that he's struggling with?
Number one,
is it the talking?
The talking, yes, and the understanding. Because he's still well nappy in that age. He's still well nappy, and he knows. But there's a mess now, and he's going to take the nappy off and throw it whatever. He's so throw it. We have to always be in after him. See what he's doing now. What he's doing now. What he's doing now.
So he does like try and signal to you guys that okay, but he just cannot say it. So the problem is also the talking.
He tear the nappy after he had used it, but not it. But hey, I want to go to the toilet. I want he does relieve himself. Then he look that this stuff is not right, and then take out the nappy.
And then the breathing. Is the breathing also an issue?
Breathing? No.
Do you think so? Probably he cannot talk like properly. Probably that's the issue.
No.
It's not.
No, because he can say magama as like sit down. Sala pansi, which is sit down. Suka up, leave that thing alone. Suku kwela up, don't climb there.
With you having went to the clinic and everything, what did they tell you? What's the problem with the child?
They say that it's autism. That is why to me, they say, okay, you have to go to there's a clinic. They give me a note. I have to go to the social worker there. That is, like I said, and the social worker said, but it must be the clinic will refer to the doctor, not me. I have to write a thing from the doctor, and I'm not supposed to take him to the doctor to make a note. It must be the clinic.
And then you went to the clinic, but nothing really happened.
Nothing really happened, and I did go maybe 3 months, 4 months to look for work in Ado. I got a brother, I got a family. Then my brother stayed there with his family. So there's not in touch, right with everything.
Okay. So what are the challenges that you are currently now facing with the child? Does he go to school? Does he have someone that's taking care of him?
No, it's only me who take him. I can't go to work. I have to look after him. He doesn't go to school because the schools. There's no, in those special schools, there's no school. I can't find, okay, let me say, but I didn't find a school that is going to be not to pay. The one I came to is going to pay, and there's a transport man, there's a school fees man, and there's a transport man. I don't have most. I only get that grant for a child, that child support grant.
What's that one thing that you would probably want to wish for your own child? What's that one wish that you would?
If I can see a doctor, number one, so he can tell me exactly this autism, what is like. Is he really autism? What to expect, what to do? Just to be examined by a doctor, man.
And that's definitely what the doctor alternative is about, because we will scan him and then the results are going to come, and then you'll definitely get the proper results and know what you can take towards.
Okay, next step.
But is there any other challenges you are facing dealing with the child in public?
You have to say, hey, sit down. Because he likes, if he's here, he's going to take this wire, he's going to put that thing back, he's going to take that out of the bag, something back, and you slide, not it, slide.
So how difficult is that, like, to manage?
Hey,
because you are with other people. What are the challenges do you face then in trying to make him understand?
I have to always, like Jeff, we are now most we are talking. But if Lucolo is here, I can't focus on you. Let's to look at you. I have to always check back. What is he doing? Where is he? What is he doing? What is he maybe ruining or taking something not supposed to take? I always look. Where's Lucolo? Where's Lucolo? I can't concentrate exactly. All the time I have to know where is he, what is he doing.
Okay, so I've noticed that obviously as a mother you would love your child like anyhow. So how do you express that to him, having like autism, as someone who can't even talk properly or probably even hear, but how do you showcase now your mother love to your son?
I try to talk to him. I always embrace him. Isa. That's where it's coming. Isa is opposed. I always kiss him. Always kiss him. Even if he hurt himself. One thing for sure. You, oh Papa, sorry, va. Kiss, and he feels better. I'm always to look at him. I want him to know that I love him. I love him. Make sure that pose always kiss. I would always, our faces always interact.
And he does that.
Yes.
And he does react to that.
Yes.
Yes. I've always noticed also, like, he has those movements. I don't know if it's the love. How did that come about?
Hey, TV, good. It's TV. They saw this thing on TV and they do it. Isa, come and battle and come and beat Isa. He saw it on TV and he knows now. So and now he has no one to play it. But if he goes outside to play with other children, he goes there. You will find other people say, "Wow, he's going that side. He's leaving go with the other children. He can't act right in about play with other children.
Yeah.
He's go." So I always play with him. That's why that kind of Isa. It's all better. It's all better. I just not to I'm not teaching him how to fight. I just want that to play. I want him to not always sitting down there or messes something up. Maybe he's breaking maybe he's tearing something. Maybe the pen or even the cloth. He can tear the cloth with his teeth. He can so I must always play with him because I'm risking it to leave him to play with other children. No, I can't take that risk because he's going. You take him to other children, but please play with him. 3, 4 minutes, 5. Lucolo is gone there. I can't play there, but he's gone.
So you've mentioned that he loves TV, right?
Yes.
And so the wrestling part comes from the TV. Don't you sometimes think of like taking other things that he can watch and learn, like to be better at understanding, and also you showing him love than wrestling also, because it also probably might be dangerous outside, as you said, because now he's going to probably want to fight.
But on the other hand, he likes soccer. I let him watch soccer. He can watch all night, even sleep in front of the TV because he likes soccer. He likes soccer. If there's a 2 matches, he plays. He watch those 2 matches. Not always that wrestling. Soccer. He loves soccer. He's there. No touching things, no breaking things. Just stay there and watch the soccer.
And the kissing part, where did you come?
The mother was. I do have other children, but as not staying with me at the time. I'm only staying. That all the love I have, but other children, I give it all to Lucol. That always pulls her. Always pulls her. And I was 35 when I got Lucol. I've got the 2002 men and 2004 men and the girl of 17 now. You see the difference, good age difference. Then it will be Lucol. After, I never thought I have another child again.
And the community now, do they accept your child?
Yes, they love. But what I don't like, they always buy him his stuff that make him hype. Chips, biscuit, stock sweet.
So you've noticed that also could be the problem.
Maybe.
Have you raised it that they should limit?
Yes, I do. But please don't buy him every day when you come to the shops. Don't other person can worry about that boy. Maybe it's take their hands, but give. So that someone does. Oh, I'm shame. I do have R1. It might change, so I can buy him chips or stock sweet. So I do go if it comes running when it's got the stuff to show me back. Look, I got this one. Sorry. So I have to quickly go to that person. I said, "Yes, thank you, but don't give him every day. He's too hype. Please don't buy him every day. Yes, you can buy him sometimes. Don't every time you go to the shop, you see him standing there and you feel oh, I can give him something. Maybe he wants something there."
So much to unpack even more, but let's just take a short break, and when we come back, we'll still continue with this.
If you are fructose intolerant, you should not eat fruit. Otherwise, it will harm your health extensively. This is a genetic disorder directly connected to ADALase enzyme deficiency. Diseases including tissue cancer.
My name is Rachel. I am 35. Well, I was diagnosed with GIST, which is gastrointestinal stromal tumours. It's really rare. It's a form of sarcoma. It starts in the connective tissues, and for me that was the lining of my stomach.
Liver disorders and mental disorders. How do you know if you are fructose intolerant? And even better, what food you must eat?
Welcome back. We are still here with our lovely guest, Nomthandazo, who is sharing her experience with her son being autistic. Now, before the break, you spoke about how he gets too hyper, So I just want to talk about now the sleeping patterns on how he sleeps. Does he even sleep?
Yes, he does sleep.
So how are the sleeping patterns?
He sleeps at night. It's some days when I would say he's not feeling well, he sleeps at the middle of the day. Always sleep at night. Now that he's older, yes, he did sleep when he was little during the day. But now he sleeps when there's always a TV. the TV, we turn off the TV when we go to sleep. The whole day the TV is playing. So he can have something to disturb him, not to make him go. Because if he's bored, he's going to break something or tear something up. That's the way he is playing. I would say to my belief, but that is he's playing when he's breaking a thing or tearing a thing apart. So the TV sometimes helps, because he can stop and look at the TV. Okay, it's a break now. It's a ad break.
Sure.
He likes soccer. And yes, he alive all night. He sleeps all night.
So I just want to know, when he's sleeping, does he have any movements?
No.
What challenges?
He sleeps like a baby.
He sleeps. There's no movement or anything
only
like
that one, you know? Before he sleeps, when he's drowsy, he make that thing. He put his thumbs in them and lay and do that until he sleeps. Even when he wakes up, he does do that. You can see up behind the blanket, but okay, he's moving. Oh, okay, he's waking up now.
So is that noise or what that could be?
Maybe noise, because if there's a film playing in the TV, it's fine. He can look at if he wants to look or if he wants to play, but the song doesn't like the song. That's where to put it. No song. Every song he has to put it there. Yes, it does. He does to look at the TV. That's the song playing, but the noise he have to close his ears.
So besides the noise, he sleeps peacefully.
Yes.
So I want you to tell me, when he's got flu, does he ever get probably breathing problems or lungs?
No, he's got flu. I took him, because he can't talk. So you don't know which part is very painful. So immediately you have to, even most at the clinic, they don't go to the queue. You have to just to say, but this one has got the autism. They have that time you enter that clinic, they have to take him to and do whatever they were going to do with him, to check him, to everything. It was going in a bunny fever. Not every time. Doesn't have a problem, health problem. Not at all.
With the breathing?
No, always right.
And I want us to discuss now about the way he eats. Does he eat a lot, and how often does he eat?
He eats like bread. Most children with bread. He's that kind. In the morning he eats the porridge, yes, fine, but he doesn't like it now. Kalok is old. He was eating from when he was now. But you have to force him. Porridge, every child have to eat porridge. So I force him to porridge. And then maybe bread again. By 10 o'clock or 10:30 in the morning. Bread. He likes bread. He can eat 5 slices or 6 if you don't have soup. Yeka. Okay, you take the bread away and put it in. He's eat nicely. He loves pap. He loves sample. He loves rice. But bread, he going to eat bread. We make most fat cooks, fat cakes. He loves fat cakes. He can eat 4. You have to take him. Then you have to no, stop now. Not another one. No, kill 2. This one is a 3rd one. No. You put them away.
And are there times, do you give him proper food that you think will help him with what he has?
Sure.
Or you just give him what he likes?
Yes, what he likes and what we have in the house. when most of the time I do make bread, because it's number one was it's easy bread, and you can eat it in the morning, you can eat it in the evening. I mean in the afternoon. If you make bread, you don't have to cook now, and you pin again, you cook again in the midday, and then you're supposed to cook at the supper at night. You see, I like to make bread, and it's easier for him because he likes it. Yes, it does eat other things, but not as much as bread.
You mentioned that he likes bread, right?
Yes.
So I want to talk about the bowel movement, and also we are Selamanzi,
Yes.
or
But you have
likes to drink juice.
You
What
must
happens?
put some sugar, like sugar. If you drink water, he drinks just a small cup. If there's no sugar. But if you want him to drink that amount of water, you have to put 1 or 2 sugar teaspoons there, and make it that bitter taste. Not he likes something with a taste.
So he doesn't face any stomach challenges
No.
as long as there's
If you give me too much bread, you have to give him too much something to drink. I always give him tea or a drink. So most bread is make you not to go to toilet. So I make sure that after eating that bread, I have to give him something to drink. I've got a bottle there, 500 ml bottle. Then I made it that portion of a cup, and he must drink it.
And with the stomach, it becomes okay because you mentioned that he likes food.
Yes.
So
and he likes something to drink.
So when there's a lot of what he's digesting,
yes,
isn't there any problem when you change him?
No,
because you mentioned that he still wears nappies.
Yes.
Is there no challenges that you face there?
No, something wrong with so it's always right here in the stomach.
And with you now coming here to Alternative, what are you really hoping for? That you really want to
I
wish?
need help. Number one is I need a health professional, someone to check him. Number one, if you can take it there, please just, if it's just like a doctor, what you say, we can check him. What is this kind of autism he's got?
What changes would you love to see happening to your son?
I want him to start. But like I said, I don't have the schools that are available. You need to put. You have to give some money, and I don't have mine. I only have that estimate, that grant for children, that normal grant for children. Yes, I only got that one. I can't, and it's not enough to buy nappies in there and buy food. That food, special food he wants, like you have to always have the money for bread. You have the money for sugar, which you have to always make something to drink. That is what it matters.
And health-wise, yindoni oyinqwenelayo
Please,
change up.
yes. To me, if I can, doctor can check him, but what is really wrong with him?
And you just wish for a better health
A better
for
health
him.
Because I love him. He's my last born. He's fine. He's a perfect child like other. He plays, he does everything like other children. But man, please, I need him to be more, to always been taking care of yourself. That way I'm saying, yes.
Okay, no, we will definitely, he's going to be taken to a scan.
Yes.
And the results shall come very soon. We're just hoping for the best.
Yes.
Thank you. Thank you so much for reaching out. Okay. So we've taken the child right now to the scan, and we'll be waiting for the results. Hopefully they will definitely come back and we'll work from there. But for me, it's goodbye.
If you are fructose intolerant, you should not eat fruit. Otherwise, it will harm your health extensively. This is a genetic disorder directly connected to adelase enzyme deficiency. Diseases including tissue cancer.
My name is Rachel. I am 35. Well, I was diagnosed with GIST, which is gastrointestinal stromal tumours. It's really rare. It's a form of sarcoma. It starts in like the connective tissues, and for me that was the lining of my stomach.
Liver disorders and mental disorders. How do you know if you are fructose intolerant? And even better, what food you must eat.
I'm here. You're probably wondering where have I gone? I'm here. Thank you to Lukolo for taking us through the motions with Namtandazo. Tandi,
Ma,
how are you?
I'm fine, Mama. And
Okay, I'm fine. All right. Well, we've listened to the journey that you have traveled with your child, your frustrations, your expectations, and the whole package that you're carrying with your child. Like Luke Paulo has told you, we're going to give you the results in detail. We will explain a whole lot of things, what's happening once we've looked at the scan to see what's really going on. But the part that I want to clarify, or that I want to help the viewers on, is the government, the South African government. I wish it was Burkina Faso, because Burkina Faso is providing free education from grade R to university. I mean, it's a milestone. But in South Africa, we're not there yet. I don't know if we're ever going to reach that. But at least we are covering, the government provides compulsory and free education to those parents that cannot afford primary. I think it's up to age 16 or 17. I stand to be corrected. So the age of your child, that child is supposed to be at school. Yeah. But I know that when the child has got special needs, it's not a case of just rocking in a school and saying, there are certain processes that must be followed. And I know that the psychologist must give a report, because they're the ones that must confirm that this child will not fit in a normal school, needs a special school. Yeah. We will help to facilitate that. Okay. Even though that is not our area. Our area is to scan, to analyze what's happening, and to turn the child around. Okay. But from just what I'm listening to you saying, and from what I'm observing, which I think the viewers are also relating to, your child has got the ability to talk. Okay, yeah. I just pick up some intellectual issues, because remember, children who are autistic are not all battling intellectually. Some of them, I mean, you get people that are scientists, doctors, but who've got autism. Doesn't mean when a child is autistic, it means that child, that all of them are intellectually challenged. Okay. But some of them, or let me say to a greater extent, you find that is the case. But it doesn't mean, when that is the case, that there is no brain stimulation that can be promoted to make sure that that brain operates at a certain level. Okay. I'll give you an example, but not an autistic example. I had a client who had TB. Yeah, who had TB meningitis. And that client became delirious. When people are delirious, that means they are mentally unstable. The cognitive abilities have been compromised. So that person could not tell whether it was here or there. And that's what happens with meningitis when it hits the brain, when it's brain meningitis. So, and then the parents came to me and they said, this child, they say, is never going to be all right. Because once you are delirious, they even said, it's periodic. You find there are certain periods where you are totally gone, and there are times when you are fine. So it fluctuates. But once you become delirious because of meningitis, you never go back to being normal. So that's what they said. So I even spoke to the doctor, and the doctor confirmed that that is the case. But then they allowed me to use my treatment program to treat, because they did not believe that I was going to turn that patient around. And that patient was seriously delirious. Yes. So I started, and the growth hormone was very low. Now remember, the growth hormone is a brain hormone. It's not, even though there are supplements that you can use, but the hormone itself is a pituitary gland production. It's a brain production. So her levels were low of the growth hormone. So the cells, some of the cells were actually dying, the brain cells, because they allowed me to scan the child at a hospital. Because remember, our scan is portable. So if we said, no, it's a foot spa. I said, okay, be my guest. So we put the feet there, and we scanned, and I managed to pick up what was happening. So then I said, I'm going to turn this child around. And it was an Indian doctor, very cooperative. Some can be very cooperative. He said, fine, and he looked at some of the products that I brought there. Said, no, but I can't even make a comment on this because I don't understand alternative medication. But be my guest. If it doesn't create complications or whatever, then be my guest. So I turned that child from delirium to total mental capacity, a total. I mean, they said, no, you don't be too hasty. It's still maybe, and she never regressed. She never regressed. Her mental sanity was totally restored. So what I'm saying is, because I can see the level of the damage within the brain, so I will be able to tell, even in your case, in your child's case, where are the issues, what is happening to the brain. But just listening to you and observing the clips, I can see that he is actually, there's a big chance of him turning around. I promise you there's a big chance, because I take children who cannot talk at all, who cannot understand, who are just nowhere. Like I was telling the other client that one parent even said in Xhosa, yo, umntanam ngumntu ngoku. That was the expression that she said. She said, "Hayi ngumntu ngoku umntanam." I said, what do you mean? She said, yo, he was just nowhere. You could not even chat or, but now ngumntu, So your child has got a big potential because from just what I'm observing, that he can chat back, he can understand some of the words, and he can put them together. There's coordination there. So there's a big chance with your child of turning around. But I'll just have to look at the scan and analyze it, and then tell you what the way forward is going to be. But there's hope, okay? But not only hope in that regard, but also on the side of placement, okay? We will help you, even if we go via the social workers, or we cut corners. I don't know. We will see, because that's not our area. But we will facilitate so that your child is blessed, you know. So I'm saying this because parents need to know that you cannot sit at home with a child just because you don't know what you're supposed to do. You need to go to the department. The department will give you the information. Yeah. Sometimes you find you don't have to go to school. You must ask for the offices of the department, because sometimes you'll find the school will just, dismiss you and not put you on the right, track or whatever. But you need to find the office of the Department of Education, because those are the people that will facilitate and send to the psychologist and so on and so on. So so there's hope for your child. There's always hope anyway. Once people come to us, once they come to us, there's always hope, because we are in a position to see what's happening, what causes this, and we'll be able to pick up other things. Like, for instance, I suspect there are diabetic issues in your child. Why am I saying that? Because he eats too much and he drinks too much and he likes sweet drink. Those are symptoms of diabetes. But I'll be able to confirm if yay or nay once I've analyzed the scan. But we will be able to take care of all those things, of all that. So so at least I'm just grateful that you've managed to come to us, and that we are in a position to help, and that there's hope for your child. Okay. Now then I'll just give this time for you to say whatever, or ask questions, or
I just want to say thank you for the opportunity, because I was in the dead end. I don't know where to go from, and I don't have my sister is not. We don't. Yes, I do have a sister, but it's not. I'm not staying with her.
Okay.
She's very busy, so I'm alone, and I have a brother who used to have a TB, and now he is challenged here in the eyes. It's not properly. He's almost blind. He must always touch things if he want to, or to put it there.
What happened to his eyes?
Hey, he has a TB some years ago. Some years ago, after the TB, you can see most other patients loses their ears.
Yeah.
Yeah, him only the eyes, not the ears. The ears are fine. He can.
Chances are meningitis also.
Yeah.
Because meninges, you see the senses, they get affected once you get a TB meningitis. Yeah, it affects the ears, it affects the eyes, so chances are it was a TB meningitis. But did they ever? But he's now TB free.
Yes, because he stays 3 months. He is treatment 6 months, but he stays 3 months at the hospital. So the other 3 months, I took a treatment for him to the house, or take him to the clinic.
Okay, all right. Yeah, I'm sure it must have been TB meningitis, because when it's pulmonary, it will not hit the but once it hits the meninges, which is common, and then it affects the senses. It affects the senses. Like I'm talking about even this one, that it affected not just the senses, but the mental capacity. That she was, she was totally delirious. Okay. I think, let me say thank you very much for allowing yourself to be vulnerable, because some people would not be willing to talk about their children and about their circumstances. But we thank you, because we're not just doing it. We're not doing it for fun. We're doing it for other people, because there are so many people who are sitting with their children who are
At
suffering.
At home.
And also one thing that I like really most about you, I see how you relate with your child. That even the fact that you lock the child up, it's not because you are embarrassed
No.
by his condition. It's because you're protecting him.
The safety.
It's for safety.
Yes.
Some parents cannot take the fact that their children are different.
Yes.
Doesn't mean when your child is different that you have done anything wrong.
Yes.
Even if it's something that is genetic, but it's still your child.
Yes.
So you don't have to be embarrassed, and some you find they dump them in institutions, you know, and all that. So it's actually quite commendable how you relate with your child, and how free he is, because I also observed, I mean, those clips are how you relate with him, you know, how you, even the fact that he's forever saying Puza. Of all the words, Puza is, you know, I mean, that's very endearing. So I really must commend you for the way you relate to your child, for accepting that this is the condition that is, and it's not his fault, it's not your fault, it's not anyone's fault, but that's just where God has placed you.
Yes.
And I trust that this journey that we're gonna walk together is gonna make you say thank you, God.
Oh.
Yeah.
Thank you. Thank you, man.
All right. That's where we're gonna end our show today. The purpose for this is for you to, because when we talk about these autistic cases, we're making references to cases that we've treated. But the fact that some parents who have got autistic children can relate to what you have heard and what you have seen today. But others are sitting with children, they're wondering, is there something wrong?
Yes.
Can I do something?
Yes.
What do I have to do if I can do something? And so on and so on. They're embarrassed, or they what? We hope that this episode is going to open the eyes, the hearts, and the ears of many of our viewers. But we'll talk to you again in the next episode, where we'll be giving you the results of the scan.
Yes.
Thank you very much for watching, and goodbye.
Thank you very much. Thank you, Mama. Thank you all the people who's helping. Very, very, I'm very grateful.
Okay. All right.